And we're following breaking news this hour on a warning from the CDC about coronavirus and children. In a new statement, CDC Director Rochelle Walensky said she's deeply concerned by the numbers of hospitalized kids with COVID-19, and specifically the number of children who require treatment in intensive care units. And she's urging all parents with children ages 12 and up to get them vaccinated. Joining us now is MSNBC medical contributor Dr. Kavita Patel. She served as health policy director during the Obama administration. Thanks for joining us. And the Washington Post reports that nearly 1/3 of 12 to 17-year-olds who were hospitalized required intensive care. Why is that? I mean, is it the new variants? Is it fewer people wearing masks? I mean, as this nation gets back to normal, it's gutting to think that our kids are at greater risk.
Yeah, Jeff, good to be with you. And you're right. It is a couple of different factors and probably more that we still haven't recognized. One major driving factor is the fact that as cases come down, people who are not vaccinated are more vulnerable. And then on top of that, Jeff, we know that 2/3 of these patients actually had chronic conditions like obesity and asthma. And that actually matches what we know about adults who are hospitalized, that they do poorly if they have other chronic conditions. So it's a reminder that as healthy as children and adolescents are, they are extremely susceptible. And these rates have been an increase, Jeff, over the last 6 months. So this is a troubling trend.
And the conventional wisdom until now is that children normally have less severe cases of COVID than adults. Could this new reporting be considered evidence that that's no longer the case?
It's not necessarily evidence that certainly adults are getting hospitalized at higher rates. But, Jeff, it is important to reflect that these hospitalization rates are much higher than previous years with influenza. I know people have kind of said kids get infected with COVID. It's like the flu. No, it's actually more severe. And to circle back to your first question, that is a product of more sticky variants and some relaxation of the actual mitigation measures, meaning we are putting kids back into sports, and that's a good thing, but not necessarily enforcing masks. And we're putting kids into group activities, but not wearing masks. So it's a reminder we are doing great as a country. We still need to protect the people who are not vaccinated, but we can vaccinate you if you're over 12. We have a vaccine authorized for that.
Yeah. What about the kids who are under 12? I mean, remind us about the best practices for keeping those kids safe.
Yeah, the best practices for keeping anybody safe who is not vaccinated or eligible is to think about the indoors as a risky environment. In fact, if you're going indoors with children and they're in a setting where they don't have a knowledge of who's vaccinated and who's not, like other kids in camps, you should have them wear masks. And I've found that kids are actually okay with wearing masks. We can help them safely wear masks. Outdoors is a very safe environment, Jeff. So I want people to encourage kids to be outdoors much more than anything else. And in the Texas heat where I'm from, you can't really get them to wear a mask properly. So you really do need to encourage them to stay outdoors, be safe. When they're indoors, try to have them wear masks.
Dr. Kavita Patel joining us on this breaking news. We really appreciate you.